Hello, everyone. Happy to have you all here to reflect upon work and activities around World Mental Health Day in this busy October. I encourage all of you to introduce yourselves in the chat with your name, organization, country, and any comments you have about this topic. I will start asking the panelists to introduce themselves. We have a round of 5 panelists today, very busy. And I start with Matt.
Thank you. Matt with Cities Rise. We're a multi-stakeholder initiative committed to transforming mental health globally through local innovation, coalition building, and youth-driven action. We work primarily in India, Kenya, Colombia, and the US, but also support a global movement of cities. It's great to be with you all.
That's great, Matt. Can you push any next one?
Yes, I will pass it to Sophie.
Thanks so much, Matt. So hi, I'm Sophie Marie Kosletsky. I'm an adolescent wellbeing consultant for the Partnership for Maternal, Newborn, and Child Health. And so recently in our work, we focused on, of course, maternal, newborn, child health and adolescence. And we just recently had the Global Forum for Lessons on the 11th and 12th of October, which I'll speak to you all about in a bit. Over to you, Christian.
Thank you, Sophie. Good morning, good afternoon to everyone. Good night, maybe. I'm Christian, I'm from Peru. I am an international consultant and MHPSS. I've been in Honduras and Ukraine this year as a consultant. And also I'm the founder of Libremente, which is a social startup devoted to work providing support to employees and organizations to be more resilient. And we also make support available for vulnerable communities in low and middle income areas within Peru. And I'm passing it to Peter, please.
Hello, everyone. Good afternoon from Ghana. And my name is Peter Yaro. I am the Executive Director of Basic Needs Ghana. And I've worked extensively, closely with United for Global Mental Health and a number of you. And nice to be part of this webinar. Over. Who is next? Is it Yushanko, right?
Yes, thank you, Peter. Nice to greet you from Ukraine. I'm Evgenia. I'm from Teenergizer. It's a youth-led Ukrainian organization, and our model basically is focusing on empowerment of young people to protect their health and exercise their human rights. We are now focusing on psychosocial support for adolescents and young people by maintaining a system of youth-friendly peer-to-peer online counseling and providing peer trainings on mental and sexual health to adolescents and youth from Ukraine. Nice to meet you. I think I'm the last one.
Yes, very welcome all of you for all parts of the world. And we have more than 50 people joining us today. That's fantastic. So I will start to look what is happening globally with Christian. I invited you to talk about the theme of this year of World Mental Health was mental health is a universal human right. What can we do to ensure mental health services are in line with human rights laws? Can you bring us 5 minutes of reflection?
Sure. That's a hard one, but
yes,
that's a very good one.
Not easy.
Yeah, sure. So let's walk through some, I think, minimum steps that we can take to make this vision of MHPSS services more in line with human rights a reality, right? So first, we must champion robust mental health legislation. That's the first one. In harmony with international human rights standards like the UN Convention on the Rights of Persons with Disabilities and so on. This legal foundation will serve as a shield, protecting the rights of those struggling with mental health conditions. I strongly recommend to review the recent joint publication from WHO and the Office of the High Commissioner of Human Rights, Mental Health, Human Rights and Legislation, Guidance and Practice. To continue, we must adhere to the basic empowerment principle that, and it seems obvious, but it's very important to say it, discrimination has no place in our mental health and psychosocial support services. We must be committed to promoting a culture of non-discrimination, ensuring that MHPSS is delivered without bias on gender, disability, race, or socioeconomic status. That's very, very, very important. Also, access to information is key. We must continue to work in order to ensure that information about mental health rights and available services is easily accessible in multiple languages and formats for all, including marginalized communities. Also, every individual should have the right to manifest informed consent for the services they are being provided. That's why we must continue our broad public awareness campaigns to inform and sensitize our societies about mental health and human rights, working to eradicate the stigma and discrimination. Well, obviously, data collection is critical. We need gather data on mental health services to identify disparities and areas that require improvement, while safeguarding privacy and confidentiality. In cases where rights have been violated, individuals must have access to legal support and remedies to seek justice and accountability. And last but not least, we need to invest as much as possible in training and capacity building for key holders, mental health professionals, law enforcement, judicial personnel, etc., instilling human rights principles in their application of MHPSS services. These basic steps can be considered like a minimum foundation for a journey. Really, it's a journey towards MHPSS services that be in line with human rights, nurturing a society that is fair and inclusive for all, especially those struggling with their mental health. Back to you, Juliana.
Yeah, what are such tasks we have around the world, isn't it? It's the basic, but it's too strong agenda that we have to follow. And as you mentioned, one of the vulnerable populations are adolescents. So I'll pass to Sophie and ask her, what are some takeaways from the Global Forum of Adolescents? How can international community leverage momentum to put your youth mental health in the forefront of the conversation?
Thanks so much, Juliana. So I just wanted to check if you can hear me. Yeah, all good?
Yes.
Perfect. No, so as most of you know, we had the Global Forum for Adolescents on the October 11th and 12th, which was really the largest gathering for adolescents and youth, and the forum took place virtually. So really the program consisted of 3 plenaries, 8 product launches, 22 core sessions across the 5 domains of adolescent well-being, which are health, including mental health, safety, connectedness, agency resilience, and education. So a lot of these sessions were then designed for adolescents, by adolescents. And we saw also, 55% of the attendees were actually under 30, which is really great to see. And a lot of these sessions are now available on YouTube, and we'll pop the link in the chat underneath as well. But really what we saw was 5,625 participants on the day across the 2 days, which really showed the dedication for adolescents from the wider community as well. But in terms of mental health being the focus of that conversation, of course, today's conversation, mental health was really a cross-cutting element. It came up within the plenaries, it came up within the 22 core sessions, and we also had our own session on mental health, really focusing on how young leaders can break the silence on this topic. So United for Global Mental Health came together with other partners and had their own session. And that session really touched upon what Christian had just mentioned, recognizing the importance of mental health as a human right and the possibilities of that moving forward in that direction, the importance of addressing stigma and discrimination, and how to really focus on addressing these with culturally appropriate strategies. And more and above that, the session really took away the importance of involving young people from the start of projects and policies. In terms of raising the visibility of mental health and, of course, building on the momentum of this forum, we also launched some products at the Global Forum for Adolescents, 2 of which I want to speak to today. The one really important one that launched in full was the Action Agenda for Adolescents, which really outlined 7 key asks for stakeholders to take forward. And the 7 asks really outline the different functions that we see coming forward. And just to highlight a few of those, we'll pop the link in the chat as well, is that we really want to see education as a universal right and vocational training offered. We want to be able to provide affordable, high-quality services for adolescents, including mental health services. 3, ensure mental well-being and resilience resilience. So that's really where mental health comes out the strongest. Reform harmful laws, strengthen and establish social protection policies, prevent stigma and discrimination, and of course, strengthen agency of adolescents and youth, where again, mental health and connectedness really comes in quite strongly. And so in terms of these 7 asks that we launched, we already have 18 governments and 2 regions who have signed up for them. And we're really working as a partnership to have more of these asks, more of these commitments come forward. And of course, we're popping the link in the chat so that we hope that you will also promote the advocacy agenda within your networks in order to really make this a reality. Second of all, we launched an interim summary of the adolescent wellbeing investment case. And just a brief overview of the adolescent wellbeing investment case. The idea here was to see which interventions and multiple interventions would be the best buck for your money, essentially, to let governments kind of see where we want to see the most investments. Mental health features as a key component of this investment case. And so as of now, we've launched an interim summary, as well as an interim kind of draft for consultation, which are both available online, and we'll pop the links in the chat as well. The kind of full report will be launched at the end of December, and we're hoping to, of course, share that with your networks as well. Really, the idea between the investment case is that we then can take this as an advocacy tool and, promote adolescent well-being at the government level. And really, the big ask in terms of what we can do today as the international community is kind of to promote these products and move forward and really follow up with your respective governments for additional commitments. And the same would be for the investment case once that becomes available, because really what we saw from the Global Forum for Lessons, given the attendance and the engagement levels that we had, that there really is a lot of momentum here, but we need the tools to kind of advocate for the change that we want to see. So really my big ask is to kind of take forward and to keep the conversation going. And if you haven't had a chance yet to see the session by United for Global Mental Health and partners, please do feel free to check it out on social media as well. Thank you.
Nice.
Nice. That's fantastic. I think we are making a lot of progress on adolescent, the center of all the process. That's fantastic. I'm going to join us, Matt, and tell us, how did City Rise commemorate World Mental Health Day, and what can you tell us about the recently launched call to action for the Century Cities movement?
Thanks, Juliana. So we commemorated World Mental Health Day on 2 levels. First, locally in the cities that we work, 2 examples. In Chennai, India, young people coming together around graffiti art to reflect and spread awareness around the theme of mental health as a universal right, paired with a facilitated mindfulness circle for young people to be sharing their hopes, fears, aspirations. And in Kenya, young people coming together with mental health experts and system leaders from the county and national governments to share and learn together. Across the cities that we work in, we see young people not only spreading awareness and advocating about mental health and well-being, but also driving really tangible action, creating peer support programs and doing their own innovations and interventions that bring us closer to mental health being realized as a universal right. Building on this, globally, we and partners in London launched a call to action for centered cities. So really briefly, centered cities is a global movement of cities fostering inner development for collective well-being. We know that current mental health interventions and systems fall drastically short of meeting young people's needs. While clinical care is extremely, extremely important, we could invest billions or trillions of dollars in increasing access to traditional clinical care alone and still fall short of meeting young people's needs. By taking a more holistic approach, integrating core aspects such as meaning, hopefulness, belonging, relationship to nature for young people, we can transform mental health and well-being, as well as broader systems and society. So the Centered Cities framework is something that's been co-created together with young leaders, researchers, social entrepreneurs, and system leaders across multiple countries since 2017. And it's based on the idea that cities pose not only significant challenges and threats to young people's mental health and well-being, but also really significant opportunities. If we take a city like New York, where I usually live as an example, there's a lot of really amazing work already going on that isn't connected with each other, that isn't really moving towards a shared vision and goals of how do we transform New York, how do we make it a centered city, or how do we make it mental health friendly. There's also a lot of people really interested in supporting young people's mental health and well-being, but they feel like that they're peripheral or that they can't act because they're outside of the formal clinical system. And so the Centered Cities framework offers 6 priority domains of action. And these are just initial domains, ones like education and learning, arts and culture, nature and environment, mental health support and services, city planning and policy, youth mobilization. And the framework is a tool that helps diverse stakeholders in the city come together, focused on a given domain, develop a shared vision and goals, and then co-design and prototype disruptive solutions and measure progress using a shared results framework. In a given city, the more and more domains that get activated, so if you have education and arts and culture and mental health support and services getting activated together, there'll be amplifying effects. And the more and more cities that get connected globally that are sharing and exchanging and learning across different cultures and contexts will further accelerate change. Centered Cities aims to create a future where cities and communities work together to support young people's mental health and well-being. And this is a key moment for more partners to come join us, help shape and grow the movement leading up to the first annual summit in late 2024. So the call to action that we launched on World Mental Health Day was we're actively recruiting for the next group of Pathfinder cities to join the current ones, as well as for innovators doing innovative, transformative work related to any of the 6 priority domains. And so between now and the first summit, so essentially over the next year, the Pathfinder cities and the innovators will continue to drive progress in their local communities, while also working together to co-create the next version of the Centered Cities framework to expand to many more cities globally. So we're actively looking and requesting recommendations for Pathfinder cities and innovators. I'll drop the links in the chat and really want to hear from you. And even if you're not in one of those groups, there are many different ways for different stakeholders to plug into the movement and help activate different cities around the world to support young people's mental health and well-being. Really briefly, on World Mental Health Day, we also launched a new thought leadership channel with Diplomatic Courier called Mental Health Reframed, so also open to any pitches from folks. And the point of this channel is to highlight bright spots of transformative work in communities around the world that are transforming mental health and well-being for young people. Thank you.
Wow. So we have opportunity to act in inner building resilience in ourselves and in the cities. And I think we have such tremendous new actions that we can be engaged around this 365 days up to the next 2024 World Mental Health Day. I really invite webinar participants to send their questions. We have such a different audience and issues to share. So please, if you have any doubt or anything you want to share, please use the chat to it. And I now invite Peter and ask him, how did basic needs in Ghana commemorate World Mental Health, and how do you plan on keeping stakeholders engaged on this issue of mental health?
Thank you very much. I say hello again to colleagues and all listening. The World Mental Health Day, as we all know, provides yet another forum where exclusively we can focus on mental health and mental health issues for a day, a week, and even the entire month. And basic needs has usually maximized that period to engage as extensively as possible. And this year was not an exception. We do recognize that the theme focusing on human rights allowed us to really zero in on that, even though everything we have done over the years, every day, have focused on ensuring that people with lived experience, their caregivers, satisfy their basic needs and exercise their basic rights. And that mental health is beyond just a health or clinical issue, but more on development. It's on poverty, it's on human rights, it's on inclusion, non-discrimination, and protection of the individual to be able to realize his or her own potential. And so what we maximized the day and week and month with was to work closely with persons with lived experience, taking advantage of mass media and to some good extent social media, which has now become a very good avenue to articulate issues of interest, and for us, mental health. So we worked very closely with media networks, and also, as is our practice and expertise, going onto the ground at the local level to work with traditional authorities, cultural and religious leaders, to give voice to people with lived experience, to express themselves in gatherings that can help convince people, educate them, change their minds, and improve attitudes towards people living with mental health conditions and the whole idea of mental illness. And I think all of us around here know around the stigma, what people perceive mental illness to be and not. We also took advantage of the print media, much as there's still a whole lot of electronic information. There's still a good section of people who read the newspapers in the news just as it is. And we took advantage to publish in one of the widely circulated newspapers in Ghana a feature on how the work of basic needs, implementing the model for mental health and development, has helped to actualize human rights of people, right from access to treatment within proximity of their communities, particularly people in rural and hard-to-reach areas, people who are less literate, to enhancing skills for care, to including self-care, to providing access for secure livelihoods, including enhancing skills and self-employment capacities for economic ventures and enterprises that people who have lived experience and primary caregivers can get involved in and be useful to themselves and their families and caregivers. We also took advantage to highlight the issues around universal health coverage because Ghana has been working on a strategy of how to achieve universal health coverage in the country. And having been part of citizen consultations on the progress of universal health coverage in countries in which Ghana was one of them, and Basic Needs led the consultation with the support of United for Global Mental Health and Waki Health. We wanted those findings and recommendations to be widely circulated and articulated for duty bearers to respond to. So we sought individual engagement with the Ministry of Health, Minister of Health, the Director for Program Planning, Monitoring and Evaluation, who happened to be part of the working group of the UHC high-level meeting, to raise the need for mental health to be well structured within the universal health coverage strategy of Ghana. So I think, just as was said by one of the panelists, we took it right from the community level to the national level, engaging in sensitization, awareness raising, but also taking advantage to influence policies, ultimately aiming at seeing increased investments in mental health, which still remains very, very low, unfortunately, within the health sector budget. I must say the conversation is continuing, as is our job. Yes, the World Mental Health Day is usually that forum where we stop everything and focus on mental health, but we use that momentum gathered, continue to engage, to continue to emphasize on the need for inclusion, on the need for people who have had lived experiences to lead the way and also realize their potential. And I must say, if there was anything different this time around, there was user-led involvement higher than has been the case. So I'll stop briefly here and allow others to continue. Over, please.
Thank you, Peter. Yeah, acting collective in all instances, we have to go to the community, up to the governance stance. So let's now give the talk to Evinia. I don't know, sorry if I didn't pronounce your name, from Ukraine. Happy to have you here. And also talking about young people, what did Teenage Advisor get up to the World Mental Health Day? And how can community-based organizations build the capacity of young people? I think we have different voices from different parts of the world. So we'd be happy to hear from you.
Yeah, thank you, Juliana, for this question. And before the start, I'd like to thank all the panelists for their exciting work they're doing on mental health. Actually, Mental Health Day was quite loaded with work in Ukraine due to the high request from the society, especially from adolescents and young people. We conducted a joint survey with another organization in Ukraine, YouReport. This survey was dedicated to the Mental Health Day, and it was about how Ukrainian youth is feeling right now due to the second year of full-scale war. And actually, the results showed their understanding that we need to put even more efforts in the mental health in Ukraine, especially for young people. So we get more than 3,000 respondents from 14 to 34 years. And actually 55% of the respondents answered that they have never sought psychological help when they were in the depressive state. That's kind of not like the result that we want to see, but that shows how much work we need to spend more to decrease this percentage. Also, 65% of respondents, they claim that they have experienced emotional depression within few weeks before taking this survey. And it's like a tiny part of the whole population, but it shows that in Ukraine it's important to put more efforts, of course, in the psychoeducation, and to be for the mental health services to be open for young people who sometimes can feel fear and sometimes can feel stigma about mental health. They don't want to say something to the stranger, even if the stranger is a specialist. Because these young people who are now in need of mental health, maybe in 10 or 15 years, they will hold key positions in the government management, in the businesses that are socially responsible. And if they have the good understanding of what is mental health, why we need to take care of it, and how can we take care of it, they will be able to further promote these ideas to another generations. Also, we get the result that 50% of respondents said that they would feel comfortable talking about the stress they're going through or fatigue with close friends whom they trust and whom they feel like equals, peers. It's actually a good example how we can involve young people to become the driver for those youth in the field of mental health, especially those peers who have a good level of awareness in the field of mental health and who can talk openly about it and help others and promote the effective narratives how to take care of your mental health. Like in Teenager, we involve teenagers, adolescent, young people to undergo absolutely free trainings on the basics of mental health, and then to provide this information to their friends or conduct the same trainings together with our organization for different youth centers, schools, and so on. Also, we involve students of psychology and social work faculties to undergo special trainings with professional psychologists and then to provide peer support on the anonymous chat on our website. And actually, within this year, we also enforced our promotion campaign of this peer counseling sessions, and within just like half of the year, we increased the requests from 1,000 per month to 3,800 more per month from Ukrainian youth and adolescents whom are in need of this psychosocial support and whom feel safe to talk about their needs with peers who they know that these peers are trained and they're professionals, but at the same time it helps to decrease the stigma and to provide this psychoeducation on such a basic level. Therefore, to make a conclusion, I think that involving young people now will result in very good outcomes within 10 years. And I want to thank everyone for their work that I do.
Wow,
thank you.
It's fantastic here from you. Just to share a little bit, in Brazil, we really believe on peer-to-peer youth education, and we think that they are much more open in increasing this welcome and secure space to talk and without the stigma, and that's fantastic. That's something we should motivate and share sometimes for our experience. That's great. So our last panelist is Florencia from Argentina. Bienvenida, Florencia. Argentina, they hold the 5th Global Mental Health Summit this October. It's a fantastic event. I couldn't be there, sorry, but United Global Mental Health and Global Mental Health Action Network were there with Sarah and James, and we would love to hear from you. What are the key takeaways from the Ministerial Summit in Argentina? I really envy it. I wish one day we'll have a summit in Brazil. And how can we get greater commitments on mental health in the Americas? As I represent America, representative Americans. So I would love to hear from you, Florencia.
Oh, thank you so much. Can you hear me?
Yes, yes.
Okay, excellent. So only a few weeks ago, we celebrated the 5th World Mental Health Summit in Buenos Aires, Argentina. It was the first time it was held in the Americas and Latin America region. It was attended by more than 600 delegates and representatives from some 20 international organizations and almost 30 countries from all over the world. This just shows the importance of mental health on a global level. On behalf of the Minister of Health, Dra. Carla Bisotti, and the work team of the Ministry of Health in Argentina, we want to thank for being the trust placed on us to host this 5th summit in Latin America. The lemma was mental health in all policies. That theme proposed by our country is a conceptual approach that invites the diverse areas of government to come together along with civil society organizations to reach a consensus on public policies. Within this synergy is that responses to the multiple and complex needs of the population regarding mental health will be achieved. It is widely recognized the intersectoral and the interactoral approach as the most important strategy when developing mental health programs, implementing them and evaluating them. So I will briefly present the conclusions and reflections produced in the 3 different sessions that we had throughout the meeting. The summit was divided into 3 plenary sessions with their respective workshops, where in a climate of respect and cordiality, the exchange of knowledge and experiences was truly acquired. Firstly, we address the issue of the social determinants of mental health. The agreed consensus had to do with the need to materialize the comprehensive conception of mental health in strategic actions that can foresee the future impact of risk factors, particularly those related to the growing precariousness of living conditions and the environmental crisis, based on the analysis of its presentation at the current moment and its future projection. This fundamentally requires the training of human capital and the construction of resilient conditions that, from a life course perspective, can strengthen people from the first years of life to face the challenges that arise from such complex scenarios. All the above cannot be programmed without the implementation of intersectoral workspaces at the different levels of the states for shared planning, execution, and monitoring. In this way, we will modify the different determinants of health disease process. Another important issue related to the determinants is the inclusion of the cultural territorial variable. The determinants cross communities in different ways according to each territory and each way of inhabiting it. The policies that are implemented must not only be respectful of diversity and people's self-determination, but must be supported by this to be effective and timely. The health inequities generated by the determinants must be responded to by a reorganization of mental health services with contributions from all sectors, all levels, and articulating with international cooperation entities, just as Juliana said before. The second topic addressed throughout the summit was the mental health policies based on a life course perspective. We reached a consensus to consider interdisciplinary work as the way to prevent future health conditions to be better. Also, as the way to intervene in a preventive, promotional way, and the way to take care of children from the first year of life, interdisciplinary work. To achieve this, it is important to create devices that strengthen mental health in the various social spaces where children live and are. All the above cannot be programmed without the implementation of intersectoral workspaces. Okay, finally, but not least important, was the subject of management of mental health services. It is essential to increase year after year the budgets allocated to the people with mental health problems, very important. An effort that must be directed at supporting strategies based on evidence and centered on people and promoting parity and integration between the physical health and mental health. So, mental health service networks must get strong in their interconnections at all times with each other and with other sectors, education, work, recreation, and others, relying on the initiatives and participation of the users themselves, based on their capabilities, resources, and desires. To do this, it is key to take care of the mental health of those who are workers. This implies, among other issues, addressing the problem of violence in the workplace, building a culture of respect and zero tolerance for all types of abuse. Finally, it is worth highlighting the relevance given during this summit to the incorporation of mental health and psychosocial support strategies in a solid and sustainable way in preparation for emergencies and disasters, as well as in the recovery stage. Mental health is an excellent strategy for repairing the damaged social fabric that, in a post-crisis context, becomes essential to comply with the premise, rebuild better. So, mental health in all policies. I hope I was clear enough. Thank you so much.
Wow, that's fantastic. That's fantastic. In fact, talking about social determinants and all the audience from early childhood to the working places and all circles of life and all environments. This is a huge challenge. And if you mentioned the topic that investment, I would say this is something that we struggle, I think, all around the world. And I have one question from the, I really thank all of you. We could stay all day long here talking and sharing with all our audience. But we have one question here. I would say, how can we engage with policymakers during key global moments like World Mental Health Day? I think you could bring us, Florencia, then I don't know, Christian, or who would like to talk about this a little bit for our participants.
In Argentina, we had the transmission online, and then we had a moment to debate in each of the workshops, and it was a collaborative work. So I assume that the communicational thing is the most important, to know when is the next summit, to attend to it with the connection, the network connection. I think we could improve that, no?
Christian or Matt would like to bring some points that you
Sure.
how
Sure, if I may.
Yeah.
So for starting, advocacy is our voice of change, advocacy. So we should stand behind the efforts of mental health organizations, NGOs, and individuals holding governments and institutions accountable for upholding human rights in mental health care. So that's very important. That's like one of our biggest roles as civil society actors. So participation and empowerment are not just ideals. That's very important to understand. They are our guiding principles. Persons with lived experience should be actively involved in decisions about their care and in the design of MHPSS policies and programs. It's not a matter of, it's not an ideal. It shouldn't be an ideal. It must be a principle put in practice. Of course, community-based MHPSS services represent a shift toward, greater alignment with human rights principles. So community support and inclusion are essential. We are, for example, proponents of peer support programs as well, because they reinforce the sense of belonging and mutual understanding within communities and so on. So the heart of the approach must be in a person-centered care model that respects the autonomy and choices of individuals, ensuring their active participation and in care plans. So where their preference and values and voices take the center stage. So yes, our approach must look beyond borders, obviously. So collaboration with national and international networks like this one is a cornerstone for our strategies. This collaborative effort ensures that we share learnings, common problems, best practices, and uphold global standards in community-based and human rights-based MHPSS services. So it's an uphill road, clearly, but it's a highly rewarding one. So thank you.
Really briefly, if I can add on what Christiane mentioned,
Sure.
I think we've heard from several panelists on the importance of youth and lived experience engagement. And what we've found is that it's one thing to, you can always lobby system leaders and policymakers and emphasize the importance of youth and lived experience engagement. You can train them and so on. But where the really transformative change happens is when there are spaces for system leaders and young leaders and lived experience leaders to really develop relationships with each other and really start exchanging with each other, not just, hey, there's this one advisory group in this one moment for a policy, but for long term. That's when you really start to see the shift in policymakers and also the young leaders sort of grow as part of that as well. So I think it can be hard to do, but that's something that we're really interested in supporting more of.
I'm happy to
That's
come
great, Matt.
well, Juliana.
Yeah, good. go.
And
Yeah,
just to
sure.
add to what everyone said, I think one of the things I really picked up upon is how many calls to action or actions for agendas there also are. And wondering, speaking to what you mentioned earlier, is that a lot of networks are doing similar things, and the need to really align also these calls for action. Otherwise we're pulling from a very small amount of funding and donors at the moment and resources. So the idea of also just aligning some of these calls would be really beneficial in making sure that the needle really moves forward collectively.
Yeah, that's great. And there's one question from the audience on the panel that is connected, that mental health affects all, especially school children, youth, and etc. And how can we tackle these groups as the increasing statistics of the mental health condition resulting in suicide? I would say what we are doing here are actions to touch. It's not easy, but and there is another question related to suicide. That was our first question from the audience. That's suicide in prison, negligence of mental health needs and rights of prisoners. Any comments? So I would say that you from youth can answer the first one, and I would love to have Christian with the human rights and the prison negligence of mental health and prisoners. It's something we are running out of time, but I think our audience needs some giving back on what they asked. Would you like? Does anyone want to complement this? How to tackle the groups of children and school and youth? I think what we are doing is exactly what you mentioned already. Would you like
Actually, yes,
to answer this, bring this for us? Great.
I can try to answer this, because actually the topic of suicide is now also in the news in Ukraine, because recently we had quite plenty of suicides, unfortunately, within young people in Kyiv. And suicides are results of not having the proper support before, actually. And that's why we have such a not that empowering statistics about suicide. But for now, our government and also all the NGOs are putting all their efforts in the psychoeducation to provide those trainings on mental health to schools, online or offline, and therefore to get the groups involved and to provide information about, if you're feeling not very good, please come to us, ask us about help. We won't even tell anyone and so on, because we have a lot of organizations who can take care anonymously, and it will be easy for young people to share what they're feeling and to understand where to go after, if they need, for example, psychiatric support, if it's not only about psychoeducation and they need some medication. Therefore, I think the first point is education, and we will have better statistics.
Sure. Please go on, Florencia, please.
No, go ahead. You have.
No, you were first, Christian. You were first.
Yeah.
Great. Very, very simply. I'm sorry if I'm too simplistic, maybe. Very basically, I think it's very important when we hear this type of issues like suicide, right? In schools or in prisons and so on, we immediately think that, yes, sure, there is a lack of clinical services in these institutions. So we need to bring, psychologists to these institutions and providing, some sort of orientation or intervention, clinical type of interventions. And sure, probably that's part of the solution. Yes, probably. But we need to think, very important, we need to start to think on early interventions, early identification, and that's paramount. So in order that we need to strengthen capacities within these institutions, thinking widely, like community interventions. So we need to strengthen capacities to early identification. We need to train peer workers. We need to train, obviously, psychologists, but we also need to train the in prisons, for example, the officers, and in the schools, we need to train, we need to work, we need to hear teachers. We need to hear them. What are their needs? What are their feelings? What are their, problems, and so on. So when we think strategically in systems, we can provide a better approach to this type of complex problems. Very simplistically, I'm sorry if I'm too fast.
No. Excellent. Just one tiny idea. I would like to share with you an experience in Argentina. We believe that the educational services and the system of health is prepared and thought by adults. And we need to change that. We need to go back and invite children to play. So we have an experience of groups of professionals, intersectionary, like psychologists and people from the community, teachers also, to prepare a time to play. So the children can play because they're losing that capacity and that time for imagination. We know that the base of mental health in the adults is how they played, how children play. So one of the strategies is to receive the demands of mental health problems in groups, which is a strategy to socialize, which is also a problem now. Children don't socialize well enough. And in the language of imagination, games, stories, in the language of children, they acquire mental health. And we're trying to write about it and prove it, how they change, how they improve in their mental health. Only by playing, only by receiving them in places prepared for them in their language.
Yeah, that's fantastic, because we in Brazil work more than 20 years with evidence-based methodologies that put children playing, but it's mental health promotion, promote to prevent. So I think the rates of suicide in all environments are really high, and this is a huge challenge, and we have to work on promotion, prevention, and treatment. That's all the approach. So I have the role to find the finish and invite you all just to a quick closing of the session. I apologize for the other questions that I think we still have one from someone from Ghana, but I think it's so. Peter, I'll give you the floor just a minute. On 2023 December, the African Mental Health Association will hold a conference in Ghana to address issues such as the statistic of mental health conditions amongst youth in stigma. How can the association be assisted in ensuring vulnerable communities representatives on mental health can be able to attend? So I think this is straight for you, Peter. And then if you answer, and then you give your final tweet land, go away from the panel, the webinar.
Thank you for excellent moderations. You've been wonderful. I would say you reach out to organizations like Basic Needs that are on the ground. I'm hearing about this conference for the first time. So if any details, I will put my address, any details that you can provide, and ask what assistance that will be needed for connections in country and in the local context will be appreciated. We are always happy to facilitate that. I hope I've answered the question. I haven't seen the details, but that's that. If you can also make publicity, you probably get more people signing up to attend it, and fostering the needed collaborations and networking that would help enhance and advance the theme of the conference. And so to close, my closing remark is just on what I've said, that we've come far, but there's still a lot to be done. And all we need to do is bring our collective efforts to build the needed synergies, then pull at different angles and achieve little. Let's strengthen our ranks to enhance what we are doing and sustain the gains. Over.
That's fantastic. I would say always it's fantastic. Is a session that, I think connections and network here. I don't know if all of you who are here, more than 50 people are in the circle. So I think sharing this information in the circle, being part of this whole community of global mental health, this is so important for us, because help can come from each part of the world or even your own country. So thank you so much, Peter. I invite Sophie to her Treaty Land to build this on momentum from World Mental Health Day. We must.
Thanks. We must amplify the agenda for action for adolescents, because it's based on the findings from young people, and then of course pave the way for stakeholders to address adolescent well-being in all of its dimensions. I hope that was tweet length.
That's great. Matt, go ahead. With you.
We must act more as a social movement. That means elevating grassroots, youth lived experience leadership, employing diverse tactics, and disrupting traditional boundaries.
Yeah. Evinia?
Yeah, actually, to build the momentum on the Mental Health Day, we must psychoeducate youth as a foundation for next generations.
Great. Christian?
Thank you.
All that my colleague said, and bringing new actors into the conversation table about regarding MHPSS, like, for example, private enterprises and so on, particularly helping them to identify their role in, for example, responding to emergencies.
Great. Florencia, you have the final words.
Thank you so much for being here. It is an honor. Mental health in all policies. That will prevent us from asking for more specialized professionals. We need to change our minds about that, I think.
That's great. We started with the thing of all this legal framework shield that Christian said, and then you finish. That's such a wonderful opportunity to share with you. I thank the audience for participating in this conversation. Let's keep on chatting on the circle in LinkedIn. And I would love to inform that our next webinar will be on digital mental health. The registration, I think it's on the chat, in the chat. And well, let's keep talking. I would share with you that I'm running to an event in Brazil that we will be launching an initiative in Rio de Janeiro, in the Museu da Manhã. It's a huge venue in Rio, and it's the mental health ecosystem. And we hope to be together with all of you in another webinar. And my friend from Argentina, we'd love to have all this takeaways from the summit in order to share with all the Americans. Thank you from Peru, all parts of the world, and congratulations for all your efforts. And work act collectively is the only way we go when we move forward. So thank you so much for all of you, and see you next time. Bye-bye.
Thank you so much.
Thank you.
Thanks, everyone.
Bye-bye. Bye-bye. Bye-bye.
Parabéns, Juliana.
Obrigada. Muito obrigada.
Goodbye.
Bye-bye.
Take care.
Tchau.
Bye.
Graças.